Today we're talking about slap tears again, and I've got my expert physical therapist friend Phil White back. This is a big show, and this show comes off the back of something we actually brushed over last episode, or one of our prior episodes, which is why is it important to get a physical assessment done by a good physical therapist prior to getting a scan to confirm your slap tear diagnosis. It is going to really change your perception and approach to rehab. So tune in, listen up, sit down, grab yourself a coffee, and we'll dive in.
Welcome to the Unity Gym podcast, brought to you by VPA Australia, our trusted supplement source since day one. As VPA sponsored athletes, we're excited to offer you a special 10% discount on their premium supplements available worldwide. Just use our discount code listed in the episode description. Today's episode is also sponsored by the Slap Tear Rehab Blueprint. If you're overwhelmed by rehab tips on social media, our blueprint provides clear, results-based methods to help you return to your favorite activities faster and stronger than surgery can get you there. Best of all, it's free. Grab it through the link in our description. If you'd like a personalized slap tear rehab program tailored to your needs and goals and support every step of the way via online one-on-one coaching, check out my slap tear rehab program. To get started, click the link in the description, create an account, complete a short pre-exercise questionnaire, and I'll welcome you on the inside. And remember, as Amazon affiliates, you can get all the equipment used in our videos and podcasts at competitive prices through our affiliate links in the description. Now let's dive into today's episode.
Stuck into this one. Had plenty of coffees this morning. My little toddler is getting up at all hours, so caffeine is sponsoring the show.
That's absolutely right. I've actually just been up to watch my son in his little sports carnival up at the Oval. It was quite cute.
Mate, I'm so pumped for that to happen when my one grows up. It's going to be good.
Yeah, absolutely. So last week we had a bit of a deep dive into slap tears. We spoke about a few different topics based on questions we're receiving from our tribe. And there was one comment that you made that I actually really wanted to elaborate on and dive into because it piqued my interest, which is why it's important to have a physical assessment before you go and get a scan. Now, a lot of people coming to us at this stage will probably already have their diagnosis. They've probably already seen a doctor or a GP and they've been sent off to get an MRI scan. Some people get ultrasounds. I don't really know why for this, or an X-ray. But to truly see what's going on inside there, you'll probably need an MRI. Now, that can have a really profound effect on one's mentality and also approach to rehab. So why don't we dive into why you don't agree with rushing into a scan?
Yeah, it's obviously tempting, both from like a patient perspective. I've been in that situation where you're just like, I just want to know what's going on in there. Like, let me just get scanned, see what's happening. And then also from a physio perspective, like it's often tempting just to like, it'd be great to just have all that information up front. Like there's a real temptation towards that. But there's been a big push to like not make scans the first thing that patients do. And there's two real reasons. And the first being like it for people who do get like a scan without the context around it, it can often be something that really freaks them out and gives them a pretty intense like thinking that something is horribly wrong as soon as they see something in an MRI. Because the problem with scans is they're given in language for practitioners. They're given in very technical anatomical language, and seeing a whole bunch of Latin words describing your insides, no matter how like severe or how like not severe, it can just be something that's like, you know, hearing words like delamination or calcification or arthritis, like all those things can just kind of get in your head as like something is, you know, intensely wrong. And there's a few reasons that we're going to go into in another episode where we go a bit deeper into pain science about why that can be a problem. But if anyone's listened to me talk about injuries before, the idea of an injury identity is a really important concept that we'll get into more in that episode. But when you're getting these Latin diagnosi of a whole bunch of different things that are going on in your body, it can be one of those things that it ends up becoming almost like you have a magnifying glass over that joint, and anything you do you feel like is going to make it worse. You're going to injure structure. So that's kind of one, is like that psychological piece for the patient. But then also from a management perspective, it's a really like well-known thing now that basically if you scanned everybody's body, you're going to have these incidental findings, which are basically structural changes. So that might be some level of arthritis or tendinopathy or calcification or any of these like structural changes that just present in bones, joints, ligaments, muscles, but they might not actually be causing any dysfunction in terms of like pain or, like problems with movement. And so the problem where this comes in is like, particularly in the slap tear context, is people sort of see a slap tear there and then think, okay, I definitely need surgery. And surgeons might see that and jump to it. And, a physio might see it and like push towards that, which then puts them on that pathway where they may or they might not get surgery, depending on, the practitioners. But there's plenty of surgeons that if you go with something that's even remotely, appropriate for surgery, they might encourage you to do it, which, that's obviously like up to them and their professional guidance. I'm not saying that's wrong or right, but there's a lot of good evidence that like many of these people will manage really well with conservative management, i.e. doing exercises. So if you start with a good, thorough, like physical assessment and subjective history, which is basically asking all the questions about your exercise, lifestyle, health history, injury history, we can get a really good picture of what's going on in your shoulder and what structures are likely influencing what's going on. And it might just be that, you might have a degenerative labral tear that's there, but the actual cause of your pain and dysfunction, might be something entirely different. And so if you're just treating this like you've got this labral tear, then again, as I said, one, it's like that psychological thing of like, oh, I've got a cartilage tear. That means, I should be super careful and not lift any heavy weights and not lift any, do any movements. And that really can, take you out of doing what you love doing. And from a professional management side of things, you might go on that, like it might set you on that path of like surgery or, that kind of more intense intervention that might not be the best outcome for you. So it's a two-pronged problem.
So just if we rewind back, because this comment from our previous episode sent me down a rabbit hole of doing a bit of research for my writing, for my newsletters and such. And, what I found was that there is kind of like three elements here that are at play. There is the morphology and what we see in the scan. There is the pain symptom or the mobility changes, and then there is often a misalignment of those two, so they don't, I guess what I'm trying to say is they don't necessarily always line up perfectly. And to give you a really, really basic example, you might have two people with exactly the same arthritis in a knee, and one of them experiences enormous problems and pain and the other one doesn't at all. And a lot of it, like, can you explain that? Like what's happening? I mean, without going too deep into the pain science, science discussion, we do want to do what we're going to do.
We want to do a dedicated pain science episode where we go deep on that. So it's kind of hard without going somewhat into it. But basically the idea is that, you don't have pain nerves. You have you have lots of different information, and it's how that information, those different information nerves are sending. So that's like heat, touch, like there is a damaged one, but that doesn't necessarily equal pain. Basically, you've got all these different nerves that your body is sending the signals up through your body. So through the spinal cord level, it's modulated by your metabolic system and your hormonal profile. Like if you're in a fight or flight adrenaline state, it's going to turn that signal down. If you're in a chronic inflammation state, it's probably going to turn that signal up a little bit. And then in your brain, your thoughts, moods, belief, and context are going to influence how your brain then has a pain experience, because pain is an experience. If you're knocked out, if you're unconscious, if you're put to sleep, like you don't have any pain because you're not there to experience it. So your thoughts, moods, belief, and context, plus the modulation of the signal that's coming in at that spinal cord level, like that has the output that is your pain experience. So there's some really, there's, I guess, like the very like psychological side of how there can be differences with, the same structural change and then someone having a completely different experience. So people who do have that injury identity, as I talked about, where every single thing they do is kind of looked at through the lens of, I'm an injured person, I'm a broken person, I can't do what I love because of, this injury that is dictating my life. And that was me for so many years. That's why I ended up wanting to become a physio, to try and get myself out of that. But there's also then, there is just like some level of, the physiological side of like, and variation. So I guess you could have like the same level of arthritis, and there's good things like with knee arthritis, for example, like if you lose 10% of your body weight, you're likely to experience half the pain you were feeling previous to that. So obviously there's like a mechanical side of things there, but there's also going to be that metabolic side of things there, because typically if you lose that weight, you're going to be in a better metabolic profile. So you could have that same level of damage, but have a completely different experience. So again, it is so multifactorial, but it's really important to realize that, if you're thinking about this recent diagnosis you had in the shoulder, you've had a scan and you've seen like that there's, degenerative labral tear, there might be some bicep tenosynovitis, you might have seen some like subacromial space narrowing with calcification of your supraspinatus tendon. Like all of that stuff sounds like it's, terminal, but really like it's just all of those findings like might, like if you just went into a physio and you were told you have a bit of a dysfunctional shoulder at the moment because, you've had a lifetime of not probably doing the best like structurally balanced training. You spend a lot of time sitting in front of a computer like this, and then you spend a lot of time driving like this, and then you spend a lot of time on your phone like this, and then you try and do some exercise, or you go out for like a hero's weekend of getting into rock climbing and you end up a bit sore. So like if you're talking about it, like if you're talking to a patient like that of, hey, here's all the reasons why you might have a shoulder that's a bit angry at the moment, and then you explain it in, hey, if we just get you back to doing some, like, let's try giving you some like really good quality exercises. Let's do something, some nice structurally balanced exercises, working within your constraints and then building up over time. Then it kind of flips that experience entirely for the patient, who instead of the person who's got the imaging first being like, oh my God, it's terminal, compared to someone being like, oh yeah, that does make sense why my shoulders like probably aren't as functional as they should be. And yeah, you know what? There are a lot of areas where I could be improving my approach to strength or just general health around my shoulders. So maybe if I do like take this approach of doing some really good strength work, and I should probably, tighten my diet a bit while I'm at it, like get on this health kick, and that's going to improve that, that systemic inflammation stuff that I was talking about. And that's going to put you in a place of feeling really confident and feeling like you're making progress. And that's one of the things that's like so big in terms of, I guess, not only like your motivation, and like, I feel like so much of health motivation is like seeing progress and then keeping moving. And it's so often that we just have one little thing that like puts the brakes on the momentum and it all goes backwards. So like if we take this approach of like, as a physio, doing a good assessment and giving someone a positive message about like why it's happened, like why they're in this current situation, but like what the positives they can do about it, and making it like make sense as to why it's got here, then I think you can set someone off on a really good like trajectory with some good positive momentum, as opposed to someone seeing a GP or just going straight to scans and then being like, oh my God, I'm broken. And then having to kind of like come back from that, and hopefully getting someone who can explain it well, or if not, getting straight to a surgeon who's like, yeah, I could probably, like we could surgically manage that. Like it's so often that they just get sort of bumped straight into that without kind of realizing there's an alternative.
Yeah. And I want to go deeper on that. I just wanted to share a personal anecdotal experience, which was that you would remember that we had the owner of a scanning facility in our gym as a member, and so we were able to go down and get an MRI whenever we wanted for free. We didn't have to pay for it, Rad and I, and it became a thing where as soon as I felt a little bit of pain, I'd be straight down there in the tube getting scanned to see what was going on. And it's funny because he just kept saying, listen, like, your body is like, when we look, like we can scan your knees, your ankle, you've had so many serious injuries. Your body looks like you've lived a life, like, but it probably has nothing to do with what you're experiencing right now, so just ignore it and continue on. What you're doing is so good and so positive and everything, and a couple of times this guy had to sort of shake me down and go, listen, stop, you don't need to come down here and get an MRI every single time you feel a little bit of a niggle or a bit of pain. And the reality is that, and what I really want to sort of, I guess, bring this discussion back onto is that it really does have the ability to completely bum steer your training and your recovery, because you might see this thing and then that becomes the thing that you're totally fixated on, when really it had nothing to do with the experience you had prior, and we're going to talk about why that has that effect, or has the ability to affect your psychology so much. And trust me, guys, if you enjoy the topic of the pain science, if that's piquing your interest in this concept of injury identity, then you're going to love an episode that we've got coming up where I've got Phil talking about this stuff, and we're going deep, and we both love talking about this. It's been quite a revelation for me personally in overcoming, because I have had some severe injuries in my life.
I love the audience who've been watching the YouTube videos of us over the years, like have ended up doing consultations with me online. Like, it's kind of exploring that with them that is often one of the most like freeing things, to realize like, okay, I can see how I'm in this situation of being like, so they really identify with that injury identity, and then seeing like, okay, here's a way out of it, and being in your program and like starting to feel like you're actually training again, rather than just again that injury naughty corner we keep talking about. Like it's just such a a powerful thing. So really important. But I just want to like quickly take this moment to say like that's not like this is not to say that scans are bad. They're like so useful and so important in certain situations. And definitely like if you see a physio who then sends you to go get a scan, or you see a GP who like they might do a bit of a screening and then says like, okay, you should probably go get a scan to make sure. There's like other really good reasons, to get scans. And part of it might be looking for, I guess, an acute traumatic injury like a severe labral tear, a Bankart lesion, like these, acute injuries that really do need specific and specialized management. But also like every time I'm working with a new patient, I'm going through some screening questions, which are making me wonder if there's anything going on here that might be the initiator of pain that isn't a like mechanical structural injury caused by training or overuse. And so like all of the, we call them like red flag signs that are looking at, could it be that there is a tumor going on, or a septic arthritis, or like infection of this area, or, some spinal, like some neural damage or something like that. All of these questions that we're asking in this initial assessment are giving us like kind of clues to suggest, okay, this is very much like injury structural, or if there's certain signs and symptoms, then we say like, okay, this sounds a bit dodgy, or it's not following like what we expect from certain types of injuries. So sending off a scan in that situation is so useful, just to be able to get that clarity on, okay, like we know that there's like what we're dealing with in terms of if it's a, mechanical or a sinister pathology. So I just want to say like, I don't want people to take this the wrong way and say that like there's no place for scans, because again, they're so useful. And even in like something like a slap tear, like once you recognize that, okay, there probably is a acute injury slap tear here, or a like severe degenerative one, or there might be some multifactorial things, like there could be a slap tear and, rupture of one of the rotator cuff muscles, something like that, then certainly sending for a scan in that situation is great. But you're doing it in the context of a therapeutic alliance of you and the physio being able to go through this together, and them to be there to explain what it all means. Because again, that's one of the big things, is like when people don't understand what it all means, then that's when they get freaked out. So that's why, like, again, scans are great, but only when used appropriately. And that sort of idea and the tendency for people just to start there is the problem.
Absolutely. Absolutely. And we're going to talk about why it's so important to have the right support network around you when you're going through this process of diagnosis. Because once you do go and get that scan and it does confirm that there is something broken, that there is something torn, that there is something that's been worn out to such a degree that is causing you problems, however the mechanism of, the pain symptom has occurred, it is confronting, and it can be quite emotionally turbulent to see that and to hear that, and to, try and make sense of the report that you get back from the professional there that's done your scans. And, I went through a very, very extreme experience with this that I'm going to share in our next episode, because this, I think, can either make or break your recovery at this point. If you have the wrong people in your corner that are in your ear, that are giving you advice, it can be really quite detrimental. And ultimately, what we're trying to do here is avoid at all costs, if we can, going under the knife and having surgery that wasn't 100% necessary. Now, in some cases, and trust me, I've been there before, surgery is necessary. I've fallen from a horse and broken my back in 3 places. I've had a knee dislocate and on the football field, and I've also had I've severed a part of my ankle and shin that was quite serious and needed reconstructive surgery. And in a few of those instances, in all of those instances, surgery was recommended. And in 2 of them, I opted to do it. The shoulder slap tear and dislocation, I was not something that I opted to have surgery on. And I'll share why, because I did it was recommended by 3 different surgeons that I needed a shoulder reconstruction after my injury, And interestingly enough, a few years after I had that shoulder injury and I had rehabbed it through exercise, and I'll share more about this in the next episode, I had a motorcycle accident and I actually landed. I went over the handlebars and landed on that left shoulder again, and caused really quite bad nerve damage because my head and shoulder was separated by the road, and it strained the brachioradial nerve there. And that has led to even more problems with that shoulder, but I've still never had it operated on. And, I function pretty well for someone who hasn't. So anyway, I hope you guys got something out of that. Have you got any final comments you'd like to finish on there, Phil, before we wrap up?
I will hold myself back because I think there's so much more to talk about, but certainly in the next few episodes, I think we'll be able to cover some really good stuff.
Yeah, absolutely. So I hope that, guys, ultimately what we're trying to do here is educate you that, in certain instances, surgery is something that you will just have to do, and we're not trying to paint a surgery and surgeons as a villain, but what we need you to understand is that it generally should always be a last resort, because orthopedic surgery is not always a guaranteed fix. There are complications that can occur. And, I've had 2 times I've gone under the knife for reconstructive surgery, and one of them was very effective and the other one wasn't. And I'll share that in the next episode.
Yeah, and I'd like to say it's not necessarily a last resort, but it's done in like that kind of this like multidisciplinary team therapeutic alliance of like having someone who can give you a balanced and informed decision, and ideally even having someone who is in communication with that surgeon to be able to make that best choice for you. Because again, it's like when you're on your own, you've got this surgeon who like they hold that real high level of prestige and of authority, and rightly so. Like what it takes to become a surgeon is like absolutely mental, and they are so knowledgeable. But it's again, like sometimes they don't have the time or the space to be able to really like work with you to understand like your particular situation and needs. And that's always the one thing, like with my partner being a doctor and me being a physio, I'm just so shocked at I'm like, how do you get through everything you need to get through in like a 20-minute appointment or less? Like, you just don't have that time to, they like GPs, for example, often seeing people for 6 minutes, 15 minutes. Whereas for me, like, I like to start like half an hour is the shortest, ideally 45. Love to spend an hour with people because often there's so much more to a life than just that like structural change, and that like the other factors in your life can really make the big difference about whether you get surgery or not. And it's just really good to have ideally this sort of therapeutic alliance of someone who's like able to understand you, on your side and informed, who can then communicate with you and the surgeon to really give you the best possible help.
Absolutely. I think we lost you for a second there, but we did get you back, and I think you could understand. But look, I have friends who are surgeons. I've got a heart surgeon friend. I've got a trauma surgeon friend, and someone who's been a member of ours in our UMS online coaching program for many years now. And, you've met Patrick, I think, online. There's certainly a place for it, but what we try to educate people on is that exercise should generally always come first, remedial or rehab exercise, because whether you choose the path of surgery or not, exercise is going to become a really, really critical component in your recovery either way.
And, and not only first in the context of shoulders, but also and especially in like the rest of your body. So even if you are going down the surgery path, like you need to figure out a plan to stay strong, stay fit, stay mobile. And so that's so often people like put their exercise and life on hold while they're waiting for a surgery and getting it and recovering from it, when really like you do need an action plan so that you come out the other side of it in a good place. And the older you are, the more important that is, because the more the natural decline you'll have if you don't do anything.
Absolutely. All right, tribe. That's all we got time for in this episode. We've gone overtime already. In the next episode, I'm going to be sharing my story of a diagnosis with a slap tear and why it is so critical that you surround yourself with the right team of professionals. We were very fortunate to do so, and I want to share how profoundly different the experience was for me than friends of mine who have gone through the same or similar process. So tune in for that one. Thank you very much, Phil. And look, before we go, I always like to say kudos to you, of all the content that you have available to you, all of the podcasts, all of the YouTube channels, all of the social media, you chose to sit here, stick it out with us, and in the name of improving yourself and your health. And I think you should be praised for that. So well done. And thank you. If you haven't already, subscribe if you like the content. And if you're watching on YouTube, gently caress that little like button. It does help with the algorithm.
And leave comments as well and ask questions, because, we love having this as like a discourse and a dialogue with you rather than, lecturing at you. So the questions, like all of our best episodes come from, really good questions from the audience.
Absolutely. All right. Thank you. Take care.